So let's start our presentation today. So the team bringing this presentation is our Forward with Dementia team, and it's a webinar focused on living well with dementia. So we'll carry on to the next slide and I'll share the outline. So the overview for our session today. So our session will be for 30 minutes. And throughout this time, we're going to share a little bit of background about the Forward with Dementia project. I'll also introduce the main speakers for today. So we have Catherine Ann Kelly and Gionet speaking to us about insights on living well with dementia. And then I'll just end off by talking about how you can get involved with the Forward with Dementia project. So just a little bit of background about the area that we're talking about today. So through our research, and I'm sure many of you who are involved in this area know that when a diagnosis of dementia is made, people living with dementia and their family care partners, they've shared that it's not often that they get a sense of hope about living with dementia, and that more supports are really needed following a diagnosis. We've also heard from healthcare providers that it can be really difficult to share a diagnosis of dementia. So from this prior work, this Forward Dementia initiative really aims to address some of these concerns by providing suggestions on communicating a diagnosis, enhancing the supports provided following a diagnosis, and providing hope that persons with dementia can live well. And it's really this last aspect that we're really going to be focusing on today. So the Forward Dementia project is really co-designed by a lot of different stakeholders from different perspectives. So it's not just designed for people with dementia and their care partners. It's really designed by and in partnership with these folks. So we've worked with people with dementia, family and friend care partners, health and social care providers across many different areas of specialty across Canada and even internationally to develop this project. And so the Forward Dementia project, it includes a website and a campaign. So these are the main areas that we've been working on. So the website includes things like articles about dementia. There's also some practical resources. So for example, we have worksheets on the website that you can work through. We also have stories from people living with dementia and their care partners. So this is real life lived experiences from their perspectives. And then we share news posts. So for example, upcoming events, and we also share the recordings of past events. So some of you may be interested in, if you didn't attend our last webinar, we did an entire webinar on our website that you might be interested in looking at. So that's something you might want to access. So in addition to the website, we also are doing a campaign, and this is to raise awareness of the website and also living well with dementia. So through the campaign, we're hosting webinars like the one we are today. We're hosting presentations and podcasts. We're also doing media interviews. So things like newspaper and radio, and of course, you can find us on social media. So we can be found on Twitter and Facebook. So now, as we mentioned, one of the parts of this project is a campaign, and part of that is hosting webinars. So today, we have two excellent guest speakers who will be presenting their lived experiences. So our first guest speaker is Catherine Ann Kelly. Catherine's been engaged in living well with dementia since January of 2009, when her mother, Belle Kelly, was diagnosed with vascular dementia. So Catherine's a mom to two kids, Xavier, 8 years old, and Chabelle, 6 years old. She's also a wife, sister, aunt, an active community member, a dementia advocate, and a conflict resolution and restorative justice practitioner. She loves photography, hikes, chocolate, and living by the sea. And she's also on a never-ending quest to be organized, aren't we all? Catherine's day job is with the Newfoundland Human Rights Commission, and she owns Got the Dementia, a dementia coaching service, and sits on multiple community boards and committees. Her happy place is cooking with her husband and hosting family and friends. So our second presenter is going to be Gionet, and she is a registered nurse. So Sherry retired back in 2018 after 34 years of specialized geriatric care. She worked the last 14 years as charge nurse for the geriatric assessment unit at St. Joseph's Hospital in St. John, New Brunswick. She collaborated closely with the Alzheimer's Society and facilitated family courses on dementia care, as well as counseling families with new diagnosis. She also completed several research projects on dementia. So since retirement, Sherry's moved to Fredericton, New Brunswick, and continues to work on research projects pertaining to dementia and senior care. So Catherine and Sherry will share their insights on living well with dementia from each of their perspectives. So I'm now going to turn it over to Catherine, who will kick things off.
Hi everyone, welcome to our session today. I just want to start by saying I'm so grateful to be associated with Forward with Dementia and for the work that this group has been doing for the last year and a bit. And I'm so happy to be with you all today. I'd like to start by acknowledging the land that I'm on as the traditional territory of the Mi'kmaq and the Beothuk people and share gratitude to live and work on this land. I'm so happy to be able to talk to you about one of the great loves of my life, my mother. And so my mom, Belle Kelly, was diagnosed with vascular dementia in January of 2009, as Shelley shared with you. And she was in Halifax with my brother. She had had a stroke 2 months prior and was diagnosed in January of 2009. And my brother called me and told me, had shared the news with me. And I remember sitting in my stairs in my house in Ottawa and feeling like someone had just completely taken the wind out of me. And I had no real understanding of dementia, as a lot of families who are new to a diagnosis don't really have an understanding. I mean, I had my aunt had passed away with dementia, probably about 15 years prior to that. And so I had these really old ideas of what that would look like. And the fear that day that I felt was really centered around what I had seen as a young person, my aunt go through. And so the next couple of weeks, was sort of just researching, Googling. I mean, that you become sort of an internet expert overnight. And then we sort of stepped back from that a little bit and just started having conversations as a family on what this meant to Mom and how she was processing it. And really talking about what we needed to do as a family and how we were going to support Mom. And I have one sibling, so it's a little bit easier than having, a large family and a lot of coordination. And so those conversations, really led to us developing an intention plan with how we were going to, I guess, process what was happening and support Mom and support each other and be mindful of our capacities, and how we were going to help Mom live and us live for the remainder of her life with dementia. And so that really led to us being really clear on what our intentions were. And so we were clear that we would never lie to Mom, and we would take care of her at home for as long as we could provide the care to her. And so those were really what my brother and I committed to our mother during that time. And, I mean, a lot of people will start off with a plan on like the logistics, but for us as a family, it was sort of important to start like, well, what are our values in this? And I offer that up to you because it really helped us through some really difficult times when things, when decisions probably got a little bit more challenging, or when we were getting information or seeing observations. And we were clear that we needed to share them with Mom. And that really helped us as a family, and I think really helped Mom trust us, and trust in what was going to happen. And so that's really how we started our 10-year journey. Mom had dementia for 10 years. She passed away in October 2018. And there's so much for people who have just been diagnosed who are on this session today. I just want you to hear how much love and how much life that can be lived throughout your diagnosis. I mean, there's this moment, I remember when we would share with people that Mom had dementia, and people would sort of like give you this look and this awkward pause, or this kind of like, oh, I'm so sorry. And that moment of waiting to whether or not you're going to get that look is sort of this awkward moment. But Mom traveled more in her first 4 years of being diagnosed because we co-cared. My brother was in Halifax and I was in Ottawa. And so she would travel back and forth. She would spend 3 to 5 months with my brother in Halifax, and then 3 to 5 months with my partner and I in Ottawa. And, you know, we had, there's certain things, I mean, like the people would say that people with dementia need to have, you know, a one environment, and it needs to be, you know, the same environment and routine. And while that may be true for some people, my mother thrived in the change of environments for those first few years. And so I share that because it's really important that you understand that, you know, you can hear from people who have lived experience, you can hear from the experts, but it's really about creating what's going to work for you and what's going to work for your life and how you want to live and your family and what your capacities are. And so, you know, we did that as a family. We just sort of figured it out. And my mom would do this really amazing thing that when she, I think it was probably like the 3 months into her being diagnosed, we were having friends over for dinner, and she was in her room and she wasn't coming down, which was unusual. And I went up before our friends came, and she's like, well, I don't really want to go down. What about if I don't say the right thing? Or what about if I forget a word? She had some word recall issues from her stroke. And I said, you know, Mom, I'm like, look, what are we going to do? Like, I understand this is difficult, but, you know, can't stay in the room for the rest of this. And she came down, and I'm not crediting what I said to her as the reason why she did this. This is all her. And she came down, and when people came that night, she would say, hi, my name is Belle, and I had a stroke, and I got the dementia. And she would do this. And she did that for the rest of her diagnosis whenever she would meet someone. And I loved it. I thought it was so brilliant because it was really her taking her power back. It was her saying in conversation, this is who I am and this is what's happening. And I may not say the right thing as I'm speaking to you, but that's okay. And I just sort of put everyone at ease. And I just saw that exchange with hundreds of people play out over the course of the next 4 or 5 years. And I quote that many people just because I had a community role in the work that I did in Ontario. And so Mom met quite a number of people when she would be with me. And it was just really amazing to see how people engaged her when she would introduce herself in that way, and how it shifted the energy. And I know that's not going to be everyone's journey. I have had close friends of mine who have not been able to share their parents' diagnosis, and their family has decided to be very private about that. So again, it's about really, you know, what works for your family culture and what works for you as a person and for your loved one. And so, you know, my mom really sort of set the tone in how we would be as a family and how we could support her. She infused an incredible amount of humor into our time together. And she said, she just sort of looked like she was really, you know, having a moment where she was thinking. And I asked her, I said, Mom, do you get scared? Yeah, do you get scared? And she just sort of said matter-of-factly, she said, you know, no, she's like, I figure by the time it gets that bad, she's like, I won't, she said, I won't realize it, so I'm, you know, I worry about you guys. And so we talked about that. We talked about that, what that could look like. And I know that's really scary for some people. I know it's scary to talk about what could happen or what your journey could look like, or how dementia will progress for you. And I'm speaking as a family member, as a caregiver, so it wasn't happening in my body and to me. I did see the vulnerability of that in Mom, and how vulnerable you are to ensuring you're surrounded by people who have the best of intentions for you, and that you can feel safe and secure with. And I think that's all about living well with dementia. Trusting the people you're with, feeling safe and secure is really important to be able to create that bowl and hold space for someone who has dementia. And so those were really important pieces in our family. You know, I would say honesty with each other was also really important in terms of how our family maintained our relationships. My brother and I didn't always agree on decisions, but we talked about it, and again, it came from that intention of love for our mother, and trust as a family. And so, you know, that's all a part of living well with dementia is your family on the same page, and can people have conversations? I think those are all really important, big value pieces. You know, sometimes people, when they talk about living well, it's all about like the nuts and bolts, which will vary for each person. I mean, like, it's important to have a good support network. It's important to have people around you who will understand that you can't necessarily text or keep up the friendships that you have, because your life is really busy right now if you're a caregiver. So having people who can support you without expecting a lot from you is also really important. I think one of the big things for us with living well was also slowing down. I made a decision to leave my career for 4 years with the support of my husband. And I had 2 babies while I helped care for mom, and she passed away at home. And so she was palliative for a couple of years before she passed away. But so during that time, during that 4 or 5 years that I was home with mom, and then eventually my 2 children that I had, you know, the big part was just shifting to this new pace that we lived at, and understanding that there's a season for everything and that you can't do everything at the same time. And sometimes the stress isn't necessarily coming from the interactions with your loved one. It's maybe coming from the outward stressors like work or how many sick days you've had to take, and, you know, and outside pressures like that. So a big part was, for me personally, was just accepting the pace that we were at now, and accepting that what we could do or what could be involved in a day, or the goals of a day, have shifted, and that's okay. You know, like a concrete example of that is, you know, I was going to bring mom and my infant son to meet a friend who was in town for coffee. And like 4 hours later of trying to get like mom ready and my baby ready, and I just am like, I can't do it. I cannot get us in the car. I'm done. And so that was a big part for me personally, was shifting and accepting. And I think I just got a message from Amy that it's time to wrap up. So thank you for that prompt.
That's great. Thank you so much, Catherine, for sharing your story. There's so much from what you spoke about that I think will help many who are experiencing this journey as well. What stood out to me is when you spoke about the importance of being honest and that open communication, whether that be with your mom or your brother, and really being true to your values. So thank you for sharing your experiences with us. And just so that everyone on the webinar knows, if anybody has a question or comment, we encourage you to use the Q&A feature on the Zoom. So post your question or comments in there. But if you'd rather wait until the end and ask your question verbally, we will also just use the raise hand feature at the end after Sherry's had a chance to speak. So what we're going to do next is we're going to have Sherry speak, and then we're going to open it up for some Q&A. So Sherry, over to you.
Hi, I'd like to thank you for inviting me to speak today. And it's quite an honor to be able to get back into my mode of counseling, teaching, all that sort of thing. Living well with dementia. In the 34 years of my geriatric career, I came up with many categories that were constantly being brought up. How do we do this? How do we do that? As Catherine said, it's really, really individual for families. So what I'm going to be talking about today is very general, and just take what you like and leave the rest, I guess, is how I would like to put it. it's really important, I guess. The biggest thing is communication with families and with loved ones. And as healthcare providers, it's important for those of us that are doing this counseling with families that we understand where they're coming from and what assistance they need. So the categories that I chose today were receiving and coping with the diagnosis, number one, because in my area of work, that is what we did. We basically did an assessment of everybody, of all of their capacities, and came up with a diagnosis at the end of the day. And we would then give that diagnosis to the family and to the patient. And then aftercare was really, really important with communication. So receiving and coping with a diagnosis was probably number one. Next, I'll just give you the very quick rundown here. Education and support, what was available in our community, and that will be different in everybody's community. 3, making plans for the future, which a lot of people had questions about right off the bat. 4, looking after your health, and then 5, day-to-day concerns. So with getting the diagnosis, everybody copes differently. Everyone and everyone's families cope differently. Some people were angry. Some people were in denial. I'm fine. Everything's great. There's nothing wrong with me. There's nothing wrong with my loved one. My biggest advice to that is go wherever that person is, and encourage them to express their true feelings, however they may be, whether you agree or disagree. You can't make people accept things. They have to come to terms with it on their own. Seek counseling if needed. There is shame for some people to seek counseling, but I really advise that can be helpful, whether it's with a healthcare professional or with a friend or with somebody who's gone through the same experience. My big one was sharing diagnosis with family and friends. And, this reduces the stigma of dementia, and then it also promotes awareness. And, with Catherine's mom saying, I've got the dementia, what a great segue to be able to talk about things. Later in the disease, all these supports can be a safety net, kind of like a neighborhood watch. If somebody's out wandering about, or if they're confused in the community, then, if people know about it, they can be of better assistance. And, I think that is all great. I think once people are accepting of the diagnosis or want to learn more about it, that's where the education and the support come in. So I think it's important to learn everything you can, which is, the purpose of Forward with Dementia and having this website available. Knowledge is power. And I think that, local Alzheimer's societies are terrific for being able to give you lots of information. Local support services are also awesome. There are family courses available. Early stage patient support groups and education groups are great. There are day programs for those that have some, dementia related issues. And those programs offer structure and socialization, meaningful activities, and then also give some respite care to caregivers. And then the support groups, which, you share your similar experiences, and maybe if you have an issue, that somebody who's been in that similar circumstance can give you some really great solutions of what worked for them. With all the COVID going on, there's a lot of online groups and chat groups, and these can also be helpful if that's how you like to communicate. And then my biggest thing is if friends and family are offering to help you, please accept the help, because we all tend to say, no, don't bother, I'm good. It takes a village, not only to raise a child, but also to manage dementia care. And so to accept that without any guilt. Future planning. This becomes a tough one. Discussing the future, because it is an unknown, you don't really know how this is going to go. But there are hard discussions to be had. And it is important to find out what the person themselves would like and what you're capable of providing. So those hard discussions, such as do not resuscitate orders, placement in a nursing home, I've heard a million times, I promised Mom I would never put her in a nursing home. Sometimes a nursing home is actually the best place for them because it's giving them stability and structure and you know, all those wonderful things that they need to reduce stress in their life. The caregiver, or the decision maker at the end of the day, you know, if you know where this person, if you have those discussions, then you can, you know, not live with guilt saying, I didn't want to be the one to say she had to go to a nursing home, or I didn't want to be the one to say that, you know, we didn't want to resuscitate them. So those guilt feelings can be alleviated if those conversations are held. Legally, arranging power of attorney, getting wills updated, all that stuff is important. Again, bank accounts, having a trusted person that's on your bank account that the bank is aware of and that they have the proper paperwork. You know, if you're still living on your own and you're managing quite well, and you might want to consider automatic bill payments coming out of your bank accounts, etc. One of the other big taboo discussions that people didn't want to talk about was talking about driving. And when is it no longer safe for somebody to drive, or when do you take away their license? My go-to was always, if I wouldn't allow my children to drive with that person, then I was feeling unsafe, and it was time to discuss it with their healthcare provider. The healthcare provider can then take ownership and put in a request to have a driving test done. And then that takes the onus off of family for removing driver's license if need be. Health, just exploring dementia medications with the medical care provider, the benefits of them versus risk, and knowing that they're not a cure, that they can maintain you in your current capacity for a while, but when is it time to stop them? And that's a discussion that should be held with the medical care providers on that. Maintaining your blood pressure, blood sugars, and all other health conditions, keeping you in the best health, which is best for your brain health as well. Making sure you check your hearing, vision, and have dental work done annually. And with sleep hygiene, you know, keeping day and night cycles in check. So, you know, making sure that you're going to bed at a good time and getting up at a good time. Day-to-day, eating nutritious meals and snacks, daily exercises such as walking, golfing, or whatever normal exercise you like to do. Brain stimulation such as puzzles, current events, art, whatever. Being out in nature is wonderful for relaxation, enjoying the music you love and watching sports that you love as well. Emotional, more so for caregivers, recognizing when you need a break and avoiding guilt feelings when you feel you need a break, because that's huge. Many of us don't want to admit that we're in over our heads and we just need a few hours of respite here. Humor, please, please, please laugh at yourself. And I know I have an ill parent, and when my mom was sick, we did a group text, and I would just update them daily, but I always tried to inject a little bit of humor in there somewhere along the line just to kind of alleviate all of the stress. And social interaction is huge, huge, huge. It's a basic human need. So continue to try and be out there, not so much in these COVID times, but once we all start getting back out there again, it will be nice to meet in small groups and, you know, try and meet in places that aren't too busy and too overwhelming. And I think really that was my chat. And if there's anything else to ask, please feel free.
That's great. Thank you very much, Sherry, for sharing your experiences. I think one of the things that stood out for me is just around the importance of sharing your diagnosis with family and friends, not only to reduce, you mentioned about reducing stigma, but you also mentioned too about creating that community of support around you to help you live well with dementia, and also the importance of social interactions. I took a lot of notes while both of you were speaking today, and there's a lot of things that stood out, but those are some of the things that really stood out when you were speaking. Just want to share as well, if anybody has questions and we don't have time to answer them today, please just reach out to us. We're going to put our email up on the screen here in a moment, and we're happy to answer your questions following the session today. And again, I want to thank Sherry and Catherine for sharing your experiences today. It's been a tremendous, it's just been so helpful hearing about your different lived experiences from the different perspectives as well, in terms of some of the advice that you guys were sharing. So now we're just going to wrap up by just sharing a few things of what's next. So for those of you who've attended this webinar, we're going to send a short survey around within about 24 hours, so you can fill out the survey. Also, we encourage you to use the website. So we're going to share that in the chat here, so you can see the link to the website that we've been referencing, the Forward Dementia website, and also to provide feedback on the website. So there's lots of opportunities to get involved and give us feedback on this project. And you can find access to more information on this on the website as well. You can reach us at info@forward-avancer.ca, or you can reach out to me or anyone on our team to learn more, to ask questions. And we encourage you as well to follow us on Facebook and Twitter. And you can see our handles here on the slide. So again, I want to thank our presenters today and also everyone who attended for taking part in this session. Enjoy the rest of your afternoon.